And we are now to take part in Digital Therapeutics Forum. I don't think we have a very good Polish word for this. Cyfrowe terapeutyki may not be the best term. Digital therapeutics, yes, it is a new category in the healthcare system and it is gaining importance. Digital therapeutics, similarly to medication drugs that we know so well, are a form of therapy. Instead of active components that influence our body, they influence our behavior. These are applications, apps. We'll discuss them during the next session. These are devices accompanied by applications that support different forms of therapy. So this is a new, vast field that I will be discussing with our guests. I hope they are with us already. We are establishing the connections right now. So let me tell you who are the panelists for the next panel. As you know, Artur Pruszko will be the moderator for this session. And a very brief introduction by Lisa Chaupain, the head of ORHA institution from the United Kingdom. Anders Stunald Hansen, an expert on digital health, will be speaking after that. And then we will have Roman Topur-Mądry from the Agency for Assessment of Medical Technologies and Tariffs. And then we shall hear Mr. Zbroński and Mr. Mikosz from Finder. Artur, you'll be moderating this panel. Yes, we are still waiting for Liz to establish a connection with us. So if I could then turn to Anders, saying, what is your approach to digital therapeutics in the Netherlands?
Andres, we cannot hear you. Probably need to.
We cannot hear you. Isn't your microphone on mute?
Yes, we can hear you. Yeah.
That's perfect. Thank you for inviting me. I will expect Liz to be part of this soon. So then she will go into the details of the concept that ORCA has been focusing on, and that also was very inspiring to the project that I'm leading, which is called the Nordic Interoperability Project. And the whole idea of this project was actually to look at cross-national border sharing of data. And the reason for that is because we all talk about sharing of data within a country, but to have the data also cross the national borders is a big, huge challenge. And in the Nordic countries, which is then Norway, Denmark, Sweden, Finland, and Iceland, we have a history of cooperation, but we don't share any healthcare data. And the Nordic healthcare system is not sustainable. And if I can make this, yes. Although the Nordic Council of Ministers, the authorities in the Nordics, have decided that in 10 years' time, we should be the most integrated health region in the world. Which is a really huge and ambitious goal. And this is both for the individual and participants, but also because we want to build a bigger healthcare industry. And to fill that ambition with some kind of content, this report called Nordic Health 2030 was taken into or developed. And that report is pointing towards the fact that we are spending today approximately 10% of GDP in the Nordic countries for traditional healthcare. But we don't spend nearly any money on preventative care, keeping people healthy, We are treating them when they become patients. And this is not sustainable. So over the next 10 years, we want this to change into a more balanced model where more investment is being done into preventative care, keeping people healthy, than just investing in treating patients when they become sick. And to make that possible, and this is where this digital health perspective comes into play, is that we point in this report to three areas where we have to change. And one of them is that we have to have a new social contract with the individual. They have to be more involved in their own care. We have to have new ways of sharing data. And we also have to see new business models where we also benefit and reward preventative care. And in this report, there's a very balanced model, and that's the model of 2030, where the individual is more involved in their own care and having and producing a lot of data. The data sharing is in the middle, and then the healthcare system, as we know it today, is on the other side. Today, the individual would probably nearly not be there at all, while the system is locking in all the healthcare data. So what we want in the Nordics for the next 10 years is to get the individual more involved. So when we started working on this, we were looking into, from the project point of view, platforms where we could connect existing healthcare data from the system. But we also wanted to address how to access data collected by the individual. And that's where the ORCA model is coming into play. Because what we wanted to have was a Nordic digital health and medication platform. And I'll come back to the setup of that. Because the problem with getting the individuals involved is that there's a huge amount of apps out there available either for preventative care, taking care of yourself, being focused on your sleeping habits or your training habits or what you eat. And there's also a lot of healthcare or digital health solutions available for care processes. The problem in the Nordics is that no one is guiding the citizens to what is a quality app and what is just a fun app. So to put that into play, we had to regulate what is not a regulated market. Today, we push the patients and the citizens toward Google Play or Apple App Store just to find whatever they think is fun. What we wanted to do is to put into place something where we could have a quality assurance of the quality apps and then guide the patients to something where their efforts of collecting data could have value. And when we met LIS and the ORCA system, we saw that what they had put in play in the UK was actually really well advanced, and they had spent a lot of years to find solutions for how to accredited healthcare, digital healthcare solutions in such a way that it could benefit both the citizen and the healthcare personnel. So what we have done is actually to cooperate with them and look into their system and try to see how we can use that system to unlock the power of digital health also for the Nordic countries. So the process that I'm doing now and the project we are doing together with them is that we are now in two phases, building an accreditation and review service based on what ORCA has already in play. We want to adjust that to the Nordic specific requirements and then look at how we also can build interoperability standards on top of that so that that data could be shared with the healthcare system over time. But having a list of accredited healthcare solutions is not enough. We also have to create a phase where we create activation and implementation of these healthcare apps into the healthcare system. So this is something that is going to be going on for two phases. We are nearly coming close to phase one, the end of phase one, and we're now starting on the phase two, where it's then putting these accredited digital health solutions into play through activation. So that was surely how we have addressed this from the 5 Nordic countries and what I was planning to present to you today.
Dziękujemy, Andrzej, za to wprowadzenie i pokazanie, jak...
Thank you very much for your introduction and showing us how to thoughtfully, systemically, you can handle the question of apps interoperability. Okay, we have been joined by Liz. Hello.
have a floor for your presentation. Teraz będzie prezentacja.
So right now it's time for presentation of ORHA, a platform that supports regulators and health systems worldwide in assessment of mobile apps. A very important task in this very complex world, like Anders said, because we have to find apps that best fit certain patient needs or therapeutic paths. Liz.
And thank you for having me with you today. I'm absolutely delighted to be speaking with you all. I've been asked to talk to you today about how you determine, evaluate and prescribe high quality digital health tools and digital therapeutics. And thank you, Anders, for your introduction to the work that we've been doing in partnership. So before I get into talking through some of the practical examples of the work that we've been doing, I wanted to first of all just work through with you what the backdrop of this work is all about. So you may already know that we have access to over 375,000 digital health apps. And when I use the word apps, I mean apps on the app stores, so on Google Play, and on the Apple App Store, but also web-based solutions and native apps. And every day we see 5 million people downloading one of these solutions independently. And when we speak to our healthcare professionals, our doctors, our nurses, our therapists, over 90% of them think that these tools could help our patients. Over 40% believe that these technologies could reduce the number of doctors' visits, and over 80% of them are already using them. So that's just a little bit of backdrop. Now, if we drill down a little bit further into what this world looks like, you can start to see what digital health apps look like by category. And you can see that over the last 3 years, we've seen a shift from products that help us to manage our wellness, so diet, fitness, to a real growth in products that can help to support health condition management. And this is really where health and care systems can really leverage the opportunity that these products present, particularly in regards to COVID and the fact that people are now self-isolating and having to monitor their own conditions. Now, if we drill down a little bit further into this world of condition-specific solutions, what you can start to see is the size of the opportunity. So 28% of this landscape focuses on mental health. And as we know, we're all moving globally into a mental health crisis. But you can also see that 16% focus on diabetes. Research has shown that if we can help our diabetic communities to manage blood sugars better, then they will have less of a negative impact if they contract COVID, let alone all of the other crises that we would avoid. And what this landscape shows us is if you can think of any condition, what we can tell you is that there is a digital health solution out there for you. And the challenge isn't, is there a solution? The challenge is there a good solution? Now, there are a number of barriers to using these solutions, and that one that I just touched on is the third one there, which is trust. How can we trust these products? However, before we even get to that barrier, there are two barriers first of all. The first is awareness is low. People, patients, healthcare professionals don't even know that these solutions exist. I myself am an NHS healthcare clinician, and I wasn't trained in these tools, and doctors around the world are not trained in these tools, so awareness is low. The second big challenge is access. Once we become aware that these solutions exist, where do we go to find them? The Apple App Store and Google Play just doesn't work at all. If you type in a word like dementia, you'll get no results found. The third and ultimate challenge is trust. How do we trust these things? How do we know if the data is going to be secure? How do we know if they're clinically assured? And the fourth big challenge is governance. And what I mean by this is if we embed solutions into healthcare systems so that doctors can recommend these solutions to their patients, how do we manage any future risk? Because these products update and change all the time. Well, it's these barriers that we've been working on for around about 6 years now to break down, to really get high quality digital health solutions to people who need them the most. And the way in which we do that is by, first of all, reviewing and approving thousands of products so we now know which ones are good. And what you will have seen over recent years is this real growth in what regulations there are available to be applied to digital health solutions. And it's a real puzzle. So you can see that there are regulations around data privacy, data security, clinical assurance, user experience. The regulatory backdrop keeps changing, new regulations come into effect. And not all of these regulations are applied to all products. So what you will have seen is that over time we've seen digital health frameworks start to emerge. So you may have heard of the DiGA in Germany, you may have heard of the NHS apps process, you may have heard of mHealth Belgium, etc. And what these frameworks are trying to do is make sense of that regulatory puzzle. Now, how do we make sense of it? Because we don't just work in the UK, we also work across the Nordics, as Anders has introduced, we work in the Netherlands, we work across the Middle East, we work in New Zealand and in America. And so how do we make sense of all of this? Well, what Orca do when we're reviewing and approving products is we approach this using a layered approach to review. The Orca review basically brings together all of the assessment criteria from all of those digital health frameworks and regulations that everybody on a global scale would be interested in. This is a 350-point assessment across data security, data privacy, clinical assurance, and user experience. And the answer to these questions is something that everybody would want to know. On top of that, we then add additional questions. So on top of that, we have the EU ISO, the new EU ISO standard, which will come into effect in January. It's just going through sign-off now at commission level, and that adds in a couple more questions around ethics. On top of that, we then have enhanced review components, and Anders touched on some of those questions that we're going to be asking for a Nordic badge around interoperability. And just to give you a different view of what that looks like and how we can all leverage from the work that everybody else is doing and we're all doing together, you can see how it layers up and starts to build into accreditation systems. So you have the Orca baseline review, additional questions to get that EU ISO, and then additional questions depending on who we're working with. So when we work with the NHS, this is what their landscape looks like. We assess products for them. They take about 70% of the Orca baseline review, about 60% of the EU ISO, and then they have a couple of additional questions in data security, clinical safety, and DPIA. We've just heard from Anders around the Nordic work. It takes 100% of the Orca baseline review, 100% of the EU ISO, and then the interoperability piece. In the Netherlands, this is what theirs looks like. I won't go into huge amounts of detail. This is the DiGA. This is the work that we've been doing across the United States. And this is in the Middle East. And what it means is that everybody can leverage from the benefit of the work that we've all done. And we've already assessed thousands of products. And that assessment happens in a duplicative manner. Every time the product updates and changes, we re-review the product. Now, as Anders said, just knowing which products are good is not enough. What we now need to do is tell people which products are good. And so what we create are front-end distribution channels, which are basically digital health libraries. These can happen at national, regional, or organisational level. And these are home branded and home targeted. We can put these in different languages. We provide wraparound communication support so that people now become aware that these products exist, have somewhere to access them, and they know that they can trust them. And we've seen some phenomenal impact of people being able to find good quality products to meet their own personal preferences and needs and clinical conditions. What we then also do is work with healthcare professionals who have touch points with their patients and these populations, and this is where digital therapeutics really comes into their own. What we do is we work with healthcare professionals who use that library now as a formulary. In the same way that doctors use formularies to know which drugs to prescribe, they now use a digital health formulary to now pick and recommend via text message the best product to their patient. They pick the product and they hit recommend and send that product to their patient. Their patient receives that product onto their phone. Now, interestingly, we also provide the digital health prescription pads. This is so that doctors who want to have a paper-based solution to prescribe digital health can have that. We also explain to healthcare professionals which products should be used at what point in the pathway and which products will have the biggest impact. We also support ongoing economic sustainability. So you may be aware of the work that's happened in Germany around the reimbursement law. And the critical thing that's happening now in lots of countries, including the NHS, is healthcare systems are wanting to pay for these products on behalf of their patients. So they're now able to pay for those solutions at point of prescription, so that the innovator, the person who's created that product, can now get reimbursed, and we can start to see true economic sustainability of this new marketplace, because unfortunately a lot of innovations don't manage to maintain a position in the marketplace at the moment. And just finally, what I wanted to say is we now have a critical opportunity. We're all experiencing the pandemic, and since COVID, digital has never been more important. What we've seen across all of our libraries and recommendation tools is significant increase. We've seen more than 6,500% increase in the number of doctors and nurses using the system to prescribe digital health tools. One of the reasons they're able to do that is because they know that that product can be trusted, but also if that product changes in the future, the system can do a recall, and so governance is established. Thank you very much, and happy to take any questions.
Thank you a lot. We'll have a lot of questions, and dziękujemy za tą prezentację.
Okay, thank you very much for this presentation. Good practices used in many countries also by regulators, state institutions and the public sector implementing health-related initiatives. Ladies and gentlemen, right now it's time for our discussion panel. I will introduce our panelists. Hello and welcome. Roman Topór-Mądry, Tomasz Mikosz, Karol Zbroński. Hello. Okay, ladies and gentlemen, I will ask Roman to comment very briefly, but before I do it, let's hear the voice of professionals, of medical professionals. I've invited Karol because it seems to me that the digital world is transforming our workplace, and perhaps young doctors are the ones who could share their experiences, because you're working with other professionals, medical professionals and patients of different ages. So what do you think about mobile apps in the healthcare sector? Apps we widely use every day, also, in the area of health, perhaps not in healthcare. Okay, thank you very much for inviting me. I'm a cardiologist, and I see shortages. I see problems with access to medical services. So I think those apps will be providing us with enormous support in managing cardiological patients and in their therapy. Well, these are usually patients with chronic diseases who need to be constantly monitored and educated to fine-tune the therapy and pharmacotherapy. And very often, those patients during appointments, which have their limits, will not be able to obtain all essential information to ask all questions. So e-tools, in their cases, of course, if we manage to get them convinced to use them, and if we manage to convince medical professionals that those apps really work, they could really be great help. A typical example, hypertension, monitoring body weight, or checking your pulse, or arterial fibrillation. There are many possibilities, and education is the way forward. And later, for example, during appointment, we can use data collated in this app. Tomasz Mikosz, what about you? Can you share your positive or perhaps negative experiences? Because I know that you were working on an app for asthma patients. And I know it's used also beyond Poland in many other countries. Well, yes, we are developing a technology that supports digital monitoring of asthma and COPD patients, what is very important in case of patients who are staying at home, who are not in the hospital. They need to be covered by constant monitoring. Very often we do not know what's happening to the patient. The patient has no contact with the physician. So this is what we do. And our app, our solution, solves this problem in a way, because it monitors those diseases, collates data, flags any deterioration in the health status. There is also a device that collects information when a given drug was taken, when health deteriorated, if it did. Implementation of such solutions is not easy anyway in Europe. There are regulatory challenges, there is very low market awareness, and recently, and in recent months, everything has changed, because the market is growing open to such solutions. We know from our experience, because we've implemented a number of such solutions, it's very important at this stage to have project leader, not from our company, but in a company that will be implementing this solution in real life. Someone who champions the project. This approach works. We know that it works, and I can really advise and recommend it to you. And I hope we will be able to get it right to address problems related to different diseases. This is a person who's the innovator, who champions the project, who takes keen interest in implementation, and will help us overcome organizational or relationship-based barriers to have this product implemented. Karol.
And from your experience as a physician, to what extent doctors are willing to recommend digital therapeutics to patients? They have their own experience, their knowledge, they study at medical faculty. So these are young doctors. Other doctors need to go through this lifelong learning process. And do they have enough knowledge? Are they willing to recommend these therapeutics? Well, in terms of cardiology, we may be leading here. We hear that these solutions are supported by scientific evidence, and this evidence shows that digital therapeutics are indeed working. And this is enough to convince younger but also older doctors to use and recommend digital solutions. Apart from strong, credible and sound scientific evidence, there should be a possibility of connecting such devices and such solutions with the currently existing databases and registers, because we should be able to use these devices and solutions in conjunction with the patient history and all the information and data we already have at our hospital or surgery or clinic. An implementation of such a solution, apart from helping a patient and doctor, may involve some additional responsibilities, because doctors would be required to carry out additional activities. Sometimes it may be discouraging for them. And there is also the question of digital literacy. Younger doctors are probably more apt. They are also more willing to adopt such solutions, but many of older doctors are very much willing to take these up as well. So it's also important to have the right legislative framework. Anders,
Czy mógłbyś powiedzieć
could you tell us from the perspective of Nordic countries, are they facing similar problems or barriers? And if you do have such problems, how would you address, if you have such problems, how would you address them?
from Polish side about the barriers, about the risk and some concerns about digital therapeutics? Do you have the same kind of risk, concerns in the Scandinavian countries, and how you approach these barriers to implement digital therapeutics?
Definitely. When we approach this, coming from a project consistent of different partners from the ecosystem, not being an authority or a national organization, we addressed this to the whole 5 countries at the same time. And what we found was that the time was extremely right, because this was on everyone's table. Everyone was discussing how to put digital health more into play. But without any kind of good system for how to do it. So when we now approach it, it's very pragmatic. We looked to NHS and to the ORCA. We saw that they have a system in play that actually worked, and we took it upon us to start the process by building this, and we got some support from the Nordic authority. There's no organization for these 5 countries. And based on that, we are now pushing the envelope, we are taking the discussions, but we are focusing on acting instead of just waiting for everyone to agree. So further down the line, when we have this accreditation model in place, when we start evaluating digital apps, we then will create this app library where we can then pinpoint to the authorities and to the different organizations that now we have quality apps approved. Wouldn't it be better for all of you to start using them? So that is our way of trying to push the barriers down by actually doing the job now, and then challenge the barriers as we meet them. But of course, there's a lot of questions on trust, accessibility, training. So definitely we will go through all of that, but we didn't want to wait. The time was right for putting digital health into play, and we started doing it. So yeah, we will have some discussions further down the line, but we think that's the way to move forward.
Thank you. W istocie to, z czym się mierzymy, nie...
Indeed, we are dealing with problems that are not local in nature. We are all facing the same challenges, similar barriers, difficulties to a greater or lesser extent, depending on the market or on the country. So I wanted to ask you, considering your experience and also how important innovative solutions in the health sector are for you, could you tell us, from the point of view of our health sector, what's your perception of this new category of digital therapeutics? If we want to introduce them into our healthcare system in a comprehensive way, do we? That's the first question. And if we do, it's quite a complex issue. And if we want to address it in a comprehensive manner, we need to look after different components. Doctors, physicians, healthcare professionals need support. Others need clear guidelines. We want these applications to add value and not to burden doctors with additional workload. There is so many different factors that need to be taken into account. Could you speak from the healthcare sector in Poland perspective? And your microphone seems to be muted. So yeah, great. Thanks. Now we can hear you. Yes, well, thank you very much. Thank you for the invitation. Thank you for giving an opportunity to listen to the previous speakers. This has all been very interesting, and I must say I have very little to add. There is no area that is more important than the ones that you have already mentioned. And when we think of digital therapeutics, what we actually want is a result. We don't want to have a tool. We want an outcome. We want a result. So in order to convince the doctors and in order to convince the patients to use these tools, we need to convince them that they will bring some additional possibilities to provide better diagnosis or to give them possibility to monitor their health in a better way, and so on and so forth. And Dr. Zbroński was very correct in saying we need scientific evidence. We need proof that these are effective. So, of course, we may have certain hopes as users as regards digital monitoring or therapies, but before we have scientific evidence, this is only hopes and expectations. We need to know what the devices and applications are actually doing, what they measure. So a very simple example. We can measure our pulse, but we need to know more than that. We need to know the circumstances, the conditions, the environment in which patient is taking these measurements in order for the measurement results to be credible. Sometimes I hear that devices are filtering sound, making it possible for us to hear better. And my doubt is the following. Am I really hearing the patient's lungs or the patient's heart, or is this some virtual sound that has already been processed in some way that is unknown to me? We are going through the internet network. We are going through a series of servers, and we are not really sure what we're hearing. Are we hearing the patient's heartbeat or lungs, or are we hearing some other interfering sounds? Then there is an element of assessing the actual outcomes, the effects of these solutions. There are many different ways of influencing patients' behavior. We want them to follow the recommended therapies, and if an application can do that, that's very good, but we need to be able to prove this. So, of course, with classical therapeutics, we have very rigid framework for evaluation. We have randomized studies, so and very controlled environment for these. And then we know exactly what we're measuring. If we look at the digital solutions, things are becoming more difficult. So we have the problem of different interference, different problems with sound, for example. And of course, we can always say that this patient is following the treatment in a better way, and he or she is doing this because this person is using an app. But are we sure about this? So I am a great advocate of digital solutions. I'm an admirer of technological developments, And I'm sure they are helpful, and they will be helpful in many different aspects of our life, be it healthcare or physical activity. They are very useful also in the times of pandemic, when we have fewer possibilities of actually seeing our physicians. But when we assess a product, we have to understand how we can demonstrate the advantages of doing this product. So these are just the basic elements. I could actually give you more examples of factors that need to be taken into account. Some of them have already been mentioned. When I look at an internet portal with or an online shop, and there are 80,000 different apps to choose from, and now how can they be integrated? How can we say, okay, a more colorful, a more playful one is for the younger users, and then a different one would be more convincing for older patients, a simpler one for elderly persons? Well, we have to take so many factors into account. We're dealing with this plethora of possibilities, and we don't really need hundreds of thousands of applications. We need to make sure that a number of parameters is measured for different diseases, and we need tools that work, that are effective. So, for example, ECG, electrocardiogram, well, you can present it in different colors, but it measures the same thing. And remote measurements are difficult. We know electrodes have to be placed in the right way. And then, we can have distortions if we do not do it correctly. And this is just a very, very simple example. There are challenges. We have to be aware of that. And both from the point of view of institutions that are responsible for assessment and from the point of view of the users, the direction is clear. We have to go there. We just need scientific evidence. Just as we need such evidence for medicinal products. This is what we need to work on. We have different partners representing different authorities, institutions, organizations, business sector, and everyone needs to work together in order to prepare guidelines that would be helpful in conducting this process, because we want applications to work and we want them to be reimbursed. Well, thank you very much. Thank you very much. If I may, I have a question for you, sir. But before that, Liz, would you be so kind as to say a few words about the problems that were just mentioned? They seem to be universal. So how are these being dealt with in other countries? This process of assessment, accreditation, making sure that a given application is credible and it really works. How is this being done? Very briefly, if you may.
Yeah, thank you. And brilliant points there. You're absolutely right, Artur. These are global issues, and the clinical assurance and professional assurance and the evidence base that sits behind these tools is absolutely fundamental part of the assessment process. You have to know not only whether these products are clinically effective and have had an impact, but also, to the points that you made, who did they have an impact for, and at what point in the pathway. So when you're talking about, say, let's use an example like anxiety. If you've got a child, a teenager, an adult and an elderly patient all experiencing the same clinical condition, anxiety, it's highly likely that they're going to need something different. And what we're all about is helping you match high quality evidence-based tools to people who need them. And you're absolutely right on the analogy around prescribing drugs. When we prescribe drugs, we know they've gone through a clinical trial. That's the bit that we do around the review and assessment. Then we have a process for prescribing the drug, and we have clear governance should there be required recall, and that's exactly what our processes are put into play to deliver. So what we're now seeing, the NHS is our longest standing place of work, and in the NHS that's exactly what we're doing for them. We're reviewing and then distributing and activating people to use the right tool at the right time. And something else that came up was about that ability to get the doctor engaged and that fundamental piece around workforce development. We wouldn't ask people to start prescribing drugs without the relevant training. We need to do the same infrastructure piece around workforce development for healthcare professionals, because at point of recommending or prescribing these tools, what we see is that 74% of everybody receiving a recommendation or a prescribed digital health tool will go on and use it, which is very similar to the percentage of people that go and actually pick up the drugs post the prescription of a drug. So you're absolutely right, and I think that that's the road that we can see a lot of countries going down now.
Thank you, Liz. Panie prezesie.
Okay, so Roman, there are problems that need to be solved, especially those problems that you have mentioned. So evidence is the key. But it's insufficient because, like Lee said, to effectively use those tools, these are very complex tools because of their context. Probably they are much more complex than simple pharmaceuticals. I'm not, talking about those specialist drugs used in hospitals. But what about Poland? Should we prepare the Polish healthcare system for, embracing this new opportunity? Digital therapeutics is a new opportunity for us. There are many elements that come into play, ranging from pure technology through the entire implementation environment, interoperability, patient paths, and building awareness. I know that it doesn't go beyond competencies of your agency, but as leaders of digital transformation, should we adopt such vision? Well, ladies and gentlemen, I think those directions have been identified. The question is, what should we do, or what should we focus on? I would reverse this question and say, is forcing or pushing forward certain digital solutions, is it going to lead us anywhere? So in other words, if we harness our money, if we invest money in the sector, we have very specific expectations from technologies. We have capabilities, we have a limited amount of money that we can spend on those solutions. But, we are operating within very specific time, frames. So if we want to look for very niche solutions, they will remain a niche. I think we have foundations, because we have funding. Funding is available for new technologies, and I'm sure, funding will be going up. I think regulations and the legal framework, I've mentioned that we have new guidelines, but we will see more of it coming up. We just have to identify what we want. Do we want to create good conditions and, be hopeful that something good may happen? Because we have a whole variety of different ideas. Or should we identify very clear, are we focusing on specific areas, on specific usages, on specific applications, and we have very specific expectations, I opt for the second approach, but it's not an easy task. I think the key is collaboration. Medical community and technology, it has to work together. I know from my experience that whenever we have sound cooperation, there are practical deliverables where there is no cooperation. There are, theoretical concepts, very advanced, but they are not translated into practical solutions. No one is using them and they are not benefiting anyone. Well, exactly, I agree with you. I think, it's a major pain of our startups because those ideas, have no clinical foundations. What you've said right at the beginning, when an idea is born, this idea is not entrenched, it's not grounded into reality. Any medical professional, what are the benefits for medical professionals? Well, will it put more strain or will it take off the strain? Recently I've been discussing because we are talking in Poland about digitalizing manual records or medical history, and I've said, I don't know if there is a doctor who would like to use a traditional pen or swap the traditional pen for an electronic pen. If it's still handwriting, what's the point of changing, conventional pen? These are things we need to consider, but they are the key. So collaboration comes first. Everything begins with collaboration. Experts and technology must come together. Okay, thank you very much for highlighting how important our objective is, because this is the starting point. We've been always defining the goal very clearly. We've been reiterating, we are putting patient first. Digital technologies must improve patients' health. And it's no different in this case, hopefully. Our overriding goal is to provide benefits for the patient. So that means that the system must become more efficient. So, ladies and gentlemen, that's the end of the panel. And, you've got 15 seconds, 2 sentences to recap or share your insights. Anders.
Well, I just want to say that while we are discussing how to put digital health into play, the individuals are choosing unsafe products at Apple App Store or Google Play. So we should definitely start with something, because today most countries have nothing. They have no guidance to help the individuals, help the patients to something that is better than what they have today. So without having a perfect situation into play or perfect system into play, start with something.
Panie Tomaszu.
I would like to shed some light because I'm sure we have many different devices measuring different parameters, but probably in the future, most devices will go mobile. So regulations, have to catch up. We need to change the mindset about designing such devices because those devices that we've seen in the past 2 decades will be few and far between. This will change dramatically, Karol. Okay, sorry, I did manage. I think that Yes, objective. You are right that objective comes first, and our objective is to improve the quality of patients' life, to improve the efficacy of therapies, and I think we have such measures available, and they may be delivered. And I hope that digital tools will help us improve those areas, but of course, they must be embraced in complex healthcare.
From you.
I was just going to reflect on two things. And as what you said, every day 5 million people download a digital health app and only 20% meet the quality criteria. So at the minute, without supporting our populations, there is a major risk. And the second thing I really wanted to leave with is that we're really keen to collaborate, Roman. I really appreciated collaboration is one of Orca's key values, and I've sent you a personal chat with my email. I'd be really keen to pick up conversations with anybody who wants to collaborate.
Thank you. Panie prezesie, czy jeszcze coś by pan dodał?
Roman? Collaboration and, starting with a vision in mind, how to prove that we are delivering expected results. I think this makes everything much easier. Okay, thank you very much for this very lively discussion, and it's a completely new topic for us, so let's wish we succeed. Thank you very much. Thank you very much, and Artur, thank you very much for moderating this session, tackling a fairly new, not very well explored topic. If you want to read more about digital therapeutics, I encourage everyone to visit our website, info.e-zdrowie. You will find the features on the background of digital therapeutics and an overview of ORHA. So you can learn more about the entire process, how apps are evaluated.